VDA system. Just a quick update, because we do that. Morgan does that on a weekly basis with the school system. They have a sit down and do a progress report. We're almost 20 out of 28 schools complete. This project is approximately 6 months ahead of schedule. Morgan has done an outstanding job, and if there's any questions, Morgan can answer those far better than I can. But that is a huge public safety concern that we are removing to protect our children in our schools, protect our responders going into those schools. So just a quick progress report on that. So I'll be happy to entertain any questions.
What's the time frame on those other 8 schools?
Hopefully by the end of June.
Great. Good.
All right, I've asked Vice Chairman Harris to read the proclamation.
All right, thank you, Mr. Chairman. The National Public Safety Telecommunicators Week, April 14th through April 20th, 2024. Whereas emergencies can occur at any time that require police, fire, or emergency medical services, the 911 Communications Center was created to provide a vital contribution to the quality of life enjoyed by the citizens and visitors to Johnston County. And whereas when an emergency occurs, the access to a 911 center dramatically improves the prompt response of police officers, firefighters, and paramedics is critical in the protection of life and preservation of property. And whereas the telecommunicators are trained, prepared, and ready, the safety of our police officers, firefighters, and EMS personnel are dependent upon the quality and accuracy of information obtained from the citizens who telephone the 911 center. And whereas public safety telecommunicators are the first and most critical contact our citizens have with emergency services. And whereas public safety telecommunicators are the single vital link for our police officers, firefighters, and EMS personnel by monitoring their activities by radio, providing them with information, and ensuring their safety. And whereas Public Safety Telecommunicators Week of the Johnston County 911 Communications Center have contributed substantially to the apprehension of criminals, suppression of fires, and treatment of patients. And whereas each telecommunicator has exhibited compassion, understanding, and professionalism during the performance of their job. And whereas National Telecommunicators Week will serve to recognize the telecommunicators of Johnston County who provide a vital public safety service. Now, therefore, be it resolved that the Board of Commissioners of the County of Johnston hereby proclaim and declare the week of April 14th through the 20th, 2024 as National Telecommunicators Week in Johnston County in honor of the men and women whose diligence and professionalism keep our county and our citizens safe. And Mr. Chairman, I'll make that in the form of a motion to approve.
Second.
We have a motion and a second. Any other comments? If not, all those in favor of adoption of the resolution, please say aye.
Aye.
Any opposed, nay? Resolution is adopted.
Mr. Chairman, Commissioners, thank you very much.
Thank you.
Thank you for your service.
Thank you.
We appreciate it.
All right, the next item is a request from the Health Department for Public Health Week 2024. We have Steve Strickland here to present the request, and I've asked Commissioner Stevens to read the proclamation at the appropriate time. Mr. Strickland.
Chairman, Commissioners, good morning.
Good morning.
Dr. Pearson sends her regrets she cannot be here today, so I'm here in her stead. We want to thank you for recognizing Public Health Week here in Johnston County, across the state, across the nation here. Just to let you know that public health is protecting, connecting, and thriving. We're all in public health. Public health is more than just health care. It's the steps we take to make sure our neighborhoods and environment are free from pollution, making sure our food and water is safe to eat and drink. It's the relationships that we foster in our communities. Public health workers are known as the invisible shield, always in the background, ensuring the public's health. I've always told employees that come to work, Johnston County Health Department, that public health is everybody, every day, everywhere. We're touching in some way. You may not realize that, but we are.
Thank you.
All right. Mr. Stevens.
2024 Public Health Week resolution. Whereas National Public Health Week is designated from April 1st to the 7th, 2024, with the theme Protecting, Connecting, and Thriving. We are all public health. And whereas the Johnston County Public Health Department serves thousands of our residents each year, and the public health workforce is a critical component of our emergency response to natural and man-made disasters and widespread disease outbreaks in our county. And whereas public health measures to control and eliminate infectious diseases, improve environmental sanitation, and promote healthy lifestyle practices have been the greatest cause of improved health status and increased life expectancy for the residents of our county and all North Carolina residents. And whereas public health plays a critical role advancing health equity and preventing chronic diseases and injuries, resulting in improved productivity, decreased healthcare costs, and prevention of the financial burdens of disease and chronic illness. And whereas public health in Johnston County is working to promote access to preventative and needed health services and to support individuals in developing the capacities and skills to achieve healthy living and reach a better state of health. And whereas communities, the local health department, employers, hospitals, and healthcare providers, individuals and families, insurers, county leaders, and policymakers, faith-based communities, and schools and child care facilities must work together to identify and develop innovative solutions to health problems facing the people of Johnston County. Now, therefore, we, the members of the Johnston County Board of Commissioners in regular session, do hereby unanimously proclaim that April 1st through 7th, 2024, shall be designated as Public Health Week in Johnston County and commend its observance to all county residents and convey our deepest gratitude to those public health professionals who serve our county every day. Chairman, I'd like to make that as a motion.
Second.
We have a motion and a second. Any comments?
Mr. Chairman, I serve on the Board of Health with Mr. Strickland and Dr. Pearson, and I also have the honor and the privilege of serving on the Board of Directors for the Association of North Carolina Boards of Health. And I will say that from having that view of a statewide operation, our county is so blessed to have the extraordinary people doing the work that they're doing, and I really commend you and Dr. Pearson and all the providers and the nurses and all the staff in public health. That's a difficult job, and y'all do an extraordinary means of doing that, and we appreciate what you mean to this county. We thank you for that. Thank you, sir.
Thank you.
Thank you.
Any other comments?
I would just comment back to that we support your support that you've given us over the years in public health. Please know that your support and funding toward our department here in Johnston County is among the top in the state. And we appreciate all you've done for us. We should all be proud of the public health department that we have in Johnston County.
Thank you.
Thank you.
Thank you, Steve. Thank you, Steve.
All right. All those in favor of the motion, please say aye. Aye. Any opposed, nay? Carries.
Thank you, sir.
Thanks, sir. All right. Next up, Social Services has a request for a proclamation for Child Abuse Prevention Month. And we have our DSS Director, Christine Dowdell, to present, along with several of her friends. And Commissioner Ted Godwin will read the resolution at a proclamation at the appropriate time. So.
Good morning. Good morning. Thank you
morning.
for having us, and thank you for your support. Behind me and with me, I have brought some members of our team, and we also have some members of our provider. I asked Mr. Strickland to be up here also because he helps us with that, and also our GAL. She's back there as well, so we just want to say thank you. We recognize that child abuse prevention is not just a Johnston County issue, it's a nationwide issue. And with that, everyone that works within the county, as well as I have to include our law enforcement, but in DSS, we have our clerical staff, we have our custodians, we have our front desk staff, the social workers, the income maintenance workers, our interpreters, just everyone is helping to prevent any child abuse and also to help provide the services to our clients. So again, thank you for your support. I've been here for, well, today is my 4th month, so it's coming along, and just wanted to say thank you, but I could not do this job without staff that are here, and then also the staff that are within the, and our community providers and at the agency. So thank you.
Thank y'all for all you do.
Yeah, thank you.
My granddad used to donate to Boys Town, USA before he died years ago. And when he died, my brother took it up. And if y'all are not familiar with that, the logo they have is a fella, a teenager carrying a little boy on his back. And the logo is, "He ain't heavy, he's my brother." And when they send me solicitations, they send stories. And it's stories like you guys hear every day. And it's just heart-wrenching what kids go through, and I thank you for what you do. And whenever the board, Commissioner Harris, hired this young lady, you did an outstanding job.
Thank you.
Let me read this proclamation. Child Abuse Prevention Month. Whereas children are vital to our county and state's future success, prosperity, and quality of life, as well as being our most vulnerable assets. And whereas all children deserve to have safe, stable, nurturing, and healthy homes and communities that foster their well-being, and whereas child abuse and neglect is a public responsibility affecting both the current and future quality of life, and whereas parents need support and resources to cope with stress and nurture their children to grow to their full potential, and whereas effective child abuse prevention strategies succeed because of partnerships created among citizens, human service agencies, schools, faith communities, health care providers, civic organizations, law enforcement agencies, and the business community. Now therefore, the Johnston County Board of Commissioners does hereby proclaim April 2024 as Child Abuse Prevention Month and calls upon all citizens, community agencies, faith groups, medical facilities, elected officials, and businesses to increase their participation in our efforts to support families, thereby preventing child abuse and strengthening the communities in which we live. Mr. Chairman, I move that we adopt this proclamation this first day of April 2024.
Second.
All right, we have a motion and a second. Any other board comments?
Mr. Chairman, if I may on this one as well. I
Go ahead.
serve on the DSS board as well, and I just want to pause for a moment and just say how proud I am of this group and all the folks over there. There's about 350 people over there that really put their heart and soul into protecting our community and serving the people that need to be served. And so I'm proud of you, and I'm thankful for the opportunity to just sit and be just a tiny little part. But Ms. Dowdell, you've hit the ground running, and I'm proud of you as well. And thank you for all the work. And to see this team here today is just really extraordinary. So thank you for what you're doing.
Thank you.
Thank you, sir.
Any other comments? All right, all those in favor of adopting the proclamation, please say aye. Aye. Any opposed, nay? Proclamation is adopted.
Thank you.
Thank you.
Thank you.
All right, Ms. Dowdell, I see you're not going very far because the next item is yours.
Yes.
And you have a request for additional positions.
Yes, yes. The Department of Social Services is requesting approval for 10 additional positions for the current fiscal year to provide assistance with increased demand for our mandated services. The total anticipated cost of these positions is approximately $927,000 and anticipate state and federal reimbursement of at least 50% of the total cost. Funds are currently available in the budget to fund this request for the fiscal year, and no additional appropriations from the general fund is required.
All right, any questions?
Mr. Chairman,
Comments?
I'll just say that I looked at what Ms. Dowdell is doing, and I think she's got an extraordinary plan to move our department into the future, and I fully support what she's asking for, and I think it will really make a difference. This county's growing, and our services are having to grow with them, and I think this is not different than any other department that we look at. So I fully support what she's asking for, sir. Thank you.
All right, any other comments? Is that in the, did I forget you made a motion, or do we have a motion to say?
I could make one. Mr. Chairman, I make a motion that we approve the request for the 10 additional positions for the current fiscal year.
I second it.
All right, yeah, I was having a moment there. I knew we were heading there, and I couldn't remember, okay, did we do that or not? So thank you for keeping me in check here.
Yes, sir.
All right, we have a motion and a second to approve the request for 10 additional positions for the current fiscal year. Any other discussion? All right, all those in favor, please say aye. Aye. Any opposed, nay? Thank you.
Thank you.
Thank you.
All right, next up, we have a request to declare May Mental Health Awareness Month, and we have the chair, Marie Dotson, here to present on that. Maybe,
Is she in the hall?
yeah, is she in the hall? No. So I have asked Commissioner, we can go ahead and read the proclamation, and then we can go ahead and adopt without Ms. Dotson being present, so.
All righty, here we go. whereas mental health is essential to everyone's overall health and well-being, and all Americans experience times of difficulty and stress in their lives, and whereas prevention is an effective way to reduce the burden of mental health conditions, and whereas there's a strong body of research that supports specific tools that all Americans can use to better handle challenges and protect their health and well-being, and whereas mental health conditions are real and prevalent in our nation, and with early and effective treatment, those individuals with mental health conditions can recover and lead full, productive lives. And whereas each business, school, government agency, healthcare provider, organization, and citizen shares the burden of mental health problems and has a responsibility to promote mental wellness and support preventative efforts. Whereas the Alliance Health, Consumer, and Family Advisory Committee representing Johnston County call upon the citizens, government agencies, public and private institutions, businesses, and schools in Johnston County, North Carolina, to recommit our community to increasing awareness and understanding of mental health, the steps our citizens can take to protect their mental health, and the need for appropriate and accessible services for all people with mental health conditions. Now, therefore, on behalf of the Alliance Health, Consumer, and Family Advisory Committee, the Johnston County Board of Commissions do hereby proclaim May 24th as Mental Health Awareness Month in Johnston County and urges our citizens to commend its observance. Proclaim this first day of April 2024. Mr. Chairman, I make that in the form of a motion that we
Second.
adopt.
All right, we have a motion and a second. Any other comments? If not, all those in favor of adopting the proclamation, please say aye. Aye. Any opposed, nay. The proclamation is adopted. And our final proclamation, we have Josh Johnston here with Community and Senior Services to come forward and present the request for Older Americans Month. And Commissioner Smith will read the proclamation at the appropriate time.
Good morning.
Good morning. Good morning.
So in the 1960s, President Kennedy declared May Senior Citizens Month. We have evolved from then, and it is now Older Americans Month, which is designed to recognize the contributions that older adults have throughout society in America. This year's theme, the Federal Administration of Community Living has designated May of 2024 Aging Unbound. And that offers an opportunity to explore diverse aging experiences and discuss how communities can combat stereotypes, and promoting flexible thinking about aging and how we all benefit when older adults remain engaged, independent, and included. And as a side note, I have been with Community and Senior Services 1 year on Wednesday. That's flown by, and I appreciate all of the support that the county commissioners have had for CSS. So thank you.
Thank you.
Thank you. Commissioner Smith.
Mr. Chairman, I appreciate you letting me read this proclamation. As last week, I finished writing chapter 82 in the Book of Life and begun writing chapter 83. So I appreciate that. And so one of the things that I've really enjoyed is reading this book, From Strength to Strength. And the author of this book is Arthur Brooks. Arthur Brooks is a professor at Harvard Business School, and he teaches happiness. And people can't believe that there's a professor at Harvard Business School teaching happiness, but that's what he teaches. And this book talks about From Strength to Strength, of how in the first part of our life we have certain strengths. And then as we age, we lose some of those strengths, but we pick up new strengths. And that to be happy in the second half of your life, you don't need to try to hold on to all the first half strengths. You need to pick up the new strengths. And I just wanted to read a couple of paragraphs out of this book. He says, to go from strength to strength requires learning a new set of life skills. We need to adopt a new formula which I have laid out in details in this book, chapter by chapter. But of course, you are unlikely to memorize the last 60,000 words. So let me summarize the whole book in 7, a formula that encapsulates all the lessons I have learned and now strive to live. Use things, love people, worship the divine. Don't misunderstand what I am saying here. I'm not exhorting you to hate and reject the world, to live like a hermit in a Himalayan cave. There is nothing bad or shameful about the world's material abundance, and we are right to enjoy it. Material abundance is what gives us our daily bread and pulls our sisters and brothers out of poverty. It reflects the blessings of our creativity and work and can provide comfort and enjoyment in humdrum days. The problem is not the noun things, but the verb to love. Things are to be used, not to be loved. Love is at the epicenter of our happiness, but love is reserved for people, not things. To misplace your love is to invite frustration and futility, and to get on the hedonic treadmill and set it to ultra fast. So let me read the proclamation now. Whereas Johnston County includes a growing number of older Americans who contribute their time, wisdom, and experience to our community. And whereas communities benefit when people of all ages, abilities, and backgrounds have the opportunity to participate and live independently. And whereas Johnston County recognizes the need to create a community that offers the services and supports older adults may need to make choices about how they age. And whereas Johnston County can work to build an even better community for our older residents by not limiting our thinking about aging, exploring or combating stereotypes, emphasizes the many positive aspects of aging, inspiring older adults to push past traditional boundaries and embrace our community's diversity. Whereas we appreciate Community and Senior Services of Johnston County for their value of inclusion and support in helping older adults successfully contribute to and benefit from their communities. Now, therefore, we, the Board of Commissioners of Johnston County, do hereby proclaim May 2024 to be Older American Month. We urge every resident to take time this month to recognize older adults and the people who serve them as vital parts of our communities. Proclaim this the first day of April 2024. Mr. Chairman, I make a motion we approve this proclamation.
I second it.
All right, we have a motion and a second. Any other comments?
Old guys rule.
Experience counts.
Experience matters.
Yeah, man, there you go. All right, all those in favor of the motion to adopt the proclamation, please say aye. Aye. Any opposed, nay? The proclamation is adopted. Thank you, Mr. Jensen. All right, the next item up is one from Emergency Services. We have Josh Holloman here to present to us regarding billing rates.
Hey, good morning, Mr. Chairman.
Morning.
Commissioners.
Good morning.
I didn't bring a proclamation, so.
Well, we're ready to read it. If you bring it,
Right,
we'll read it
maybe
for you.
next month I should have one.
That'll be mine if there's the only one left. Yeah.
No, I first want to just take a moment and just say thank you to this board for all your support for our entire Emergency Services Department. I think our men and women out there do extraordinary jobs every day, and we couldn't do that without your support. And also just want to say we love and will miss Mr. Tony Braswell and all the support he provided us over the years. So thank you for that. So yes, I am here to talk to you about EMS billing rates. Billing rates are set by the county commissioners. The fees, essentially, those are set based on the established Medicare rates that are approved. And so, as you all know, we have only been one agency, one system for a few years now, so that has allowed us to look at things that we need to address. And one of those things that came up is the fact that we haven't adjusted our billing rates since 2015. So that's the reason for me being here today. What we are asking is, it's our recommendation to adjust our billing rates to 120% of the Medicare allowable, which is customary for our county to be at that amount, and that's what we were previous to 2015, before we started falling behind. We'd also like to ask that you allow us to essentially stay at 120% of the Medicare allowable rate. That, of course, will change each year, and that will allow us to stay at that amount, or that percentage. I just want to also mention, it's important to make sure we're clear that, the billing rates just allow us to recoup some of the cost of doing business and being prepared for all the things that we have to be prepared for. Never will EMS be an enterprise fund or make any money, but it just allows us to offset some of the expenses for what we have to be able to be prepared for the job out there. So with that, I'll be glad to take any questions.
Any questions?
No, sir. Mr. Chair, I'll just make a comment. I mean, it is customary to do 120 or even 130% of Medicare allowable. And what that does is just allow us to capture any available revenue on the table from private insurance payers and so forth. So that's a normal process in the EMS world, and I would fully support and keeping it that way. And that way we don't have to go back and revisit it every year.
Thank you, Mr. Harrison. Also, that reminds me, I want to mention for our citizens, we do have the subscription program that's very helpful as well.
Yes.
That's $60 a year, and those mail-ins should be going out very soon. And essentially, that allows, we will bill the insurance, and then if our citizen here has that subscription, then they're not responsible for any out-of-pocket cost. So that's a very beneficial program as well.
Yes.
All right. Any other questions?
Is this a recommendation from the Emergency Medical Services?
It is, yes, sir. Our recommendation is 120%.
Mr. Chairman, if you're ready for a motion, I'll make a motion we approve the request for EMS.
Second.
All right. Was that the motion?
Yes, sir.
We already had a second.
Oh, I'm sorry. Okay.
All right, we have a motion and a second to approve the request. Any other comments? All those in favor of the motion, please say aye.
Aye.
Any opposed, nay? The request is approved.
Okay, thank you for your
Thank
support.
you.
Thank you.
Thank you, Josh.
All right, next up, we have one board, the Johnston Lee Harnett Community Action Board, that has more applicants than we have for the single position available. We have 3 applicants who are Utica Kaysen, Samantha Harding, and Joyce Holloman. And as we have been doing for some time now, the ballots are at each one of your seats. If you would complete those, sign them, and turn them into the clerk at the conclusion of this meeting. We will tally those and announce them at the start of the 6 o'clock meeting tonight. All right, and that brings us to delinquent tax collection report. We have our Administrator Jocelyn Andrews here to present to us on that.
Good morning, Mr. Chairman and
Good morning.
Commissioners. Before you, today, you have the February collections report. As you can see, we're on pace with last year as far as on the real and personal levy and also with registered motor vehicles. So we're trying to finish the year strong as we get into the hard part of collecting the little bit that's left. But we are very thankful for those who have already submitted their tax payment. We could not do it without the citizens of this county who take it so seriously. Next thing is, I want to give you a very brief update on our reevaluation process for the 2025 tax year. We're moving right along. We're at about 80% of our field visits that have been performed by our vendor, Pearson Appraisal. So I'm pleased with that, and hopefully they'll finish those so we can start getting on to the next phase of that. But also, as part of this, and as part of the normal revaluation process, we mail letters to income-producing businesses throughout the county, and we mailed over 2,000 letters last week, and the phone calls have already started this morning. Basically, where we request certain information. related to those properties. And so we have sent those letters out. It's just, and we tried to put it on the letter, if the business is owner occupied, we don't need any information. It's only when it's being sublet to somebody else and that kind of information. And that is just one of the things that we have to do to make sure that we're determining market for those type of properties. The last thing I want to kind of bring to your attention, I have been looking into potentially going with a new collections platform for my collections side of the office. We have several ways people can pay, and it's a little disjointed, and I'm trying to make it where it's a little more seamless for the citizens in this county, just trying to make sure there's some consistency there. So the things that we're looking into are bringing in maybe even in addition to the consistency, some new features, kind of bringing it into the 21st century. So if there's no objections from this board, I plan to proceed with this and hopefully have it in place for the 24 billing cycle, which will be kicking off after the first of the next fiscal year. So all this will start hopefully and be in place by July. I'll be happy to take any questions.
Any questions from Ms. Andrews? All right.
Thank
Any objection to her proceeding with her plan?
No, sir. Thank you.
Proceed on with that, yes. Thank you.
Thank you.
All right, next up, we have manager report and comments.
Good morning.
Good morning. Good to see you coming up here and talking to us.
Yes,
again. Yeah. Welcome.
Yes, thank you. I have, over the past couple of meetings, have been talking about an item that I know some of you are familiar with, and this is a regional transportation study with the Regional Transportation Alliance, which is going to involve several counties. And they're going to look at bus, rapid transit, other types of transit. And most of the communities, if not all, are making a contribution to this project. DOT is going to actually handle this contract and handle all the bids and that kind of thing. But it's my recommendation that Johnston County contribute $25,000 to the study. I think that would be a pretty good number to work from. So I want to make that recommendation this morning. I know we've talked about a couple of meetings. I know the chairman chairs the Campo, and I know they have been involved in that as well. So I don't know if you have anything to add to that.
Yeah, I would just say that Vivian Jones is the chair. Make sure I'm the vice chair.
Vice
yeah,
chair.
I've been the vice
Sorry.
chair on that. But it's one of those things that as a region, they're looking at Campo's participating. A lot of other towns and counties are participating at a higher level than we are. I'll lean into the microphone as I'm sitting back. But one of the things you'd mentioned bus rapid transit, I think one of the things it does, it looks at that multi-person travel. I don't want to say bus rapid transit is the only one, but it looks at opportunities for how to get riders onto the system. So I think that is one of the unique, it's not just run routes here, it's some, what I would say, some fairly creative things that's happening in other states where they can make it for the people to access that. So that I think that is the benefit of it. And again, we're participating along with many other local governments in our region on that. So.
Right. And not to be confused at all with commuter rail, as I think that is pretty much
this is
at this point. So
yeah.
Thank you for considering that.
Yeah, I was gonna say I think that from now on, anytime somebody says commuter rail, and part of it, they're using the wrong words. So I think commuter rail is out of the vocabulary of folks in this region for a while.
Do we need a motion for that 25,000?
That would be good.
Yeah.
Just for everybody.
Got one.
All right, we have a motion to approve the $25,000 for the RTA study. Did I hear a second?
I'll make a second.
All right.
I just want to make sure I didn't.
So it's going to die for lack of second.
All right, we have a motion and a second. Any other discussion? If not, all those in favor, please say aye. Aye. Any opposed, nay? All right, motion carries.
Thank you.
Thank you, sir. All right, that brings us to board reports and comments.
I received an email, I think from you, but it came from the NCACC about agricultural farms in Johnston County, and I was really pleased to see we still have 920 individual farms in Johnston County. I think we're 5th in the state. So that's commendable. That looks like the work we're doing to try to save our farm and save our agricultural heritage is doing some good. So just want to bring that out. And also want to heads up to our employees. When we see the participation and the attitude to the people from social services and all this morning, I think we've got just the best employees anywhere. And I think we need to let them know that every opportunity we get.
I agree.
Commissioner Godwin?
Let me just move my NC State University cup out of the way.
I thought you should put it up there on the top.
Amen.
Since the
Amen.
rest of us are up here jealous that you're there, but happy.
Oh, yes.
I guess this is where I claim my graduate school and say, yeah,
There you
go
go.
back, yeah.
I want to mention a couple things, Mr. Chairman. Friday, March the 29th, was the Vietnam Veterans Day. And we had a ceremony here at the courthouse Friday afternoon at 3 o'clock. It was sponsored by the local chapter of the Daughters of the American Revolution. It was a very nice affair, well attended. I had a speaker, and I just want to thank them for that honor and program that they put on for the Vietnam veterans. The other thing is, it has left me. It'll come back to me.
Go back. Just remember, go back.
That's what
No,
part
it
of the
had to do-
older citizens.
So that proclamation should have considered senior moments. We had a meeting with the key players in dealing with the Alliance Healthcare that we're all a part of, and mental health. And Commissioner Harris led that meeting last Thursday, I believe. And I think we're making good progress in trying to arrange some positive, tangible actions to help our citizens dealing with this mental health crisis, and to help the local health care providers and maybe alleviating some issues we've had at the hospital and other places where the people are not well served in that circumstance. So we'll keep you updated.
Vice Chairman?
Yes, sir. Thank you. I'll just expand on that, and I appreciate Commissioner Godwin's valuable insight and participation in those meetings. We did have a very good meeting Thursday with Alliance and all the players with DSS, the health department, the county staff, attorney, everybody was there that to try to figure this out. And we really are making a lot of progress, and we've identified 3 sort of top priorities that I think are going to really be beneficial to the people here in the county. And there'll be more to come on that. My goal is to see us have some type of recommendation before this board for the next budget year to be able to proceed forward with some initiatives that will help address the mental health crisis that we have in the county. So more to come, sir. Thank you.
Thank you. Commissioner Stevens? Commissioner Smith?
Yeah. I want to, especially since Ted just said what he said, I want to comment about what Arthur Brooks says about that. Ted, to give you solace and for me to have solace, and maybe Dickie Braswell soon to have solace. But he says that early in life, your brain is just like grease skids. You can just go, 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 go. And that as you age, it's like a library, and you keep putting books in there, and you keep putting books in there, and you keep putting books in there, and it gets crowded with all those books, which are experiences you've had in life. And then when someone says, when you try to recall a name, which I struggle with, or something like that, it's amazing that difficult things are easy to remember, but to go back in that library and find something that's in there, he says that for older folks, it takes longer to get through all the books in the library to find the one you're looking at, and eventually you get it, but it just takes time.
Indeed.
All right.
I tell everybody my computer needs to reboot.
All right, and I did not have any reports at this time, so and I guess maybe a reminder, I know that this has been out there for about 3 months now, but we do have a public hearing on our fire service tax districts this evening, so remind folks of that. And with that, we do have a need for a closed session, and I will entertain a motion to go into closed session.
Okay. I move the board go into a closed session for the following purposes: to consult with an attorney employed by the board in order to preserve the attorney-client privilege pursuant to NCGS 143-318-11A3, to discuss matters related to the location or expansion of industry or other businesses in the area pursuant to NCGS 143-318-11A4, and to establish or instruct staff concerning the negotiations, price, and terms of a contract concerning the acquisition of real property pursuant to NCGS 143-318-11A5.
Second.
All right, we have a motion and a second to go into closed sessions for the reasons stated. All those in favor, please say aye. Aye. Any opposed? All right, and we will not be taking any action after we come out of closed session. So with that, we'll take a few minutes to clear the boardroom before we go into our closed session.